Emmy Adkins with CFCC. The healthcare issue has been a big problem over the last couple months with the new reform bill. Today I talked to a couple students and a new pharmacist about the healthcare reforms and how they affect students.
Overall, from what I've read about the healthcare reforms, basic understanding that I have of it is it's giving a better handle for people that are in the low income, especially when it comes to just basic care, like going to the dentist, going to see a doctor. I think it's a good idea.
I don't know. I want to be a doctor when I grow up, hopefully, when I grow up. So I don't like how they're just going to pay doctors a certain salary when I'm going to work my little butt off to try and make more money. I don't think it's fair just to be put on a certain salary. I'm going to be working pretty hard.
I like the idea of a new bill. I don't really agree with all the provisions in this bill, but I feel like over time and through reform it will start to work itself out.
One part of the bill that many feel will be beneficial to young adults begins August 1st. It says that anyone under the age of 26 can stay on their parents' insurance until they find insurance themselves.
My dad actually called me and asked me if I was going to graduate school, and he said the only way I'd be able to stay under his plan is if I was still in school, so I'm not really sure if that still applies if you're not in graduate school, but that's what I've heard.
Well, particularly uninsured and low-income students receive benefits kind of in large aspects of Medicaid, and so it gives coverage that wouldn't otherwise be there with subsidies. As well as if you have a pre-existing condition. I mean, students or anybody else, that's an additional benefit of it.
I think if you need it, it's a good thing, because I think that everyone should have some form of health insurance. But if you're out, and you have a job and you don't really need their insurance and you're, able to get it on your own, then you shouldn't be taking money away from people who really do need it.
I talked to Joel Johnson, a recent graduate from the pharmacy school at MUSC, about how he sees insurance affecting students.
It's going to make things more affordable by providing insurance to kids that are just getting out of college, people that just got a job, maybe couldn't get insurance through their work or whatever. And I think it's going to help out a lot, just making it more available to everybody. Kids that couldn't get anything and were getting hurt, or need prescriptions getting paid for, that kind of stuff. Just hospital bills that can add up. When that takes care of that, it really takes a lot of financial burden off of people, and I think that's going to be good, but we'll see what happens with the whole overall economy. That's going to have to rebound a little bit.
After talking to people around campus and Joel, you can see that the healthcare bill has its pros and cons. For CFCC, I'm Emmy Adkins.